Isn't it brilliant that you're all here today? I think it's fantastic. And I think the answer to public service reform is in this room. It really is. So I'll tell you a little bit about Wigan before I take you through a few kind of ideas and a provocation to you all as leaders in the third sector. But we work really closely with the brilliant Fiona Leese, who was the Chief Executive East Ayrshire when I was at Wigan. Do you want to stand up, Fiona? Can we give her a nice round of applause, Fiona? She's brilliant. So we learned a lot from what was already going on and some fantastic practice up in East Ayrshire, working differently with communities. And I think it's brilliant that you're learning from other examples nationally and internationally as well. So I was going to start off with a bit of a provocation. This is the absolute right time to challenge public services. They are doomed without the input of you and the third sector, absolutely on their knees already. So my first provocation is, if not now, when? When are we going to do this big transformation? We've been talking about it, as Alan said, since Christie came out. Now is the time for action. We can't keep talking about it. Scotland is much better, I think, in government terms, of policies than England, much better, but it's the translation into action that sometimes we stumble with. If not us, who? If not the people in this room, the energy and the ideas that are in this room is what's going to save public services and save communities, I think. And finally, if not this different approach I'm going to describe, then what? What can we do? We can't keep recovery and resetting. It's got to be about a complete reimagining. Alan's kind of stolen my speech, but that's exactly what I was going to say. Restore hope and really put the third sector, people in this room, right at the heart of neighbourhoods and transformation. So the work we did in Wigan was a long-term kind of journey, and we started off working in a place called Worsley Mains, an area of social housing, an area of high levels of poverty. And we started off working with 25 families whose children were on the edge of being taken into social care, children's social care. And we mapped out every single interaction we'd had as public servants, social workers, police officers, people in drug and alcohol services, domestic violence, everything. We mapped it out over 20 years. And we worked out that at the end of each year, despite spending on average $500,000 a year per family, children and families were generally in either the same position or a worse position. So what we were doing was continually assessing them. 80% of our time was spent on assessment rather than help, rather than direct help. So we realised this was a problem. It was where all the money was going, and it was where we were failing children and families. So we decided to take those lessons from Worsley Mains and spread it right across the council. Start to directly help people and spend your time doing that rather than continually filling in forms and assessing them. 80% of your time on assessment, that's criminal, isn't it? That's not what public service is. That's not why we all became public servants. We joined public services to help people, and that's just not what we're doing. By the end of 10 years, we'd managed to save 200 million, just the council. And we've managed to add an additional 7 years of healthy life expectancy in the poorest wards, poorest parts of Wigan, by resetting the way we worked and making it relational by default. So instead of having assessment at the front door, we got to know people. We got to understand the reality of their lives, and we helped them. And that's why I think you, as third sector leaders, are key, because that's just what you do. That's just how you work with people. That's how you help communities. And that's why the public services need to learn from you, need to learn a different way of working. Every single interaction that we had in Worsley Mains was based on silo services, individual bits of services, all doing what they thought was the right thing, measuring people against eligibility criteria. How many people have eligibility criteria in their organisations? Basically, you've got to be really bad before we can help you. And if you're not really bad, go away, get worse. But, really try to break away from those silo services because they don't work. I remember I ran the clinical commissioning group in Wigan, as well as the council at one point, eating disorder services. Huge backlog, huge delay in people being able to access help. And basically we had a body mass index eligibility criteria. If your body mass index is not below a certain level, go away. We can't help you. go away, become more ill, and when you're ill enough, then we can help you with a set of prescribed things that we've created with no input from you or anybody else who's suffered from an eating disorder. Is that the right way to work with people? Absolutely bonkers. So breaking away from the silo services. And I think what you tend to find in some organisations is bubbles of good practice. Little bubbles, little experiments, pilots, really radical teams of people. I call them the Rebel Alliance. I think you are all members of the Rebel Alliance because you can see just how broken things are and you just try to help people in a very direct and meaningful way. But these little bubbles, these little experiments are not sustained. They tend to get strangled by the system, and the system drags itself down with the weight of design, and it kind of freezes these people out. So when the money runs out, the project and the good practice stops, and these people are kind of ostracised. You know, it's not good for your career to be a member of the Rebel Alliance, but I always have been, and I hope you always will be as well. So this is a story. You won't be able to see the detail of this, and it's not really the detail I want you to focus on. It's the number of interactions in a real man's journey, a man called Brian, who lives in Gateshead, a real man who's got, he's been in and out of the criminal justice system, he's had issues with substance abuse, and he's got no family or friends to support him. These are the different interactions that Brian's had in his life with health, the police, the court system, probation, housing, a whole series of public services working to support Brian. These are literally the number of interactions that Brian has had over a couple of years. So he's had almost £1 million worth of health presentations, including all of those figures there. And that equates to one Band 7 nurse working full-time for 14 years. So the way that we support people isn't supporting people, it's processing them through a sausage machine of assessment and referral, assessment referral. There's no direct help. So this work in Gateshead, led by a brilliant man called Mark Smith, he's fantastic, he's very much a member of the Rebel Alliance. He basically said, right, we've got to stop the way we work and to support people like Brian. And we've got to reach out and support him meaningfully with a key worker, somebody gets to know, gets to trust, who can navigate the complexity of the system with him and can draw in the specialisms that he needs to help him get his life back on track as and when they're needed. And what we do at the moment is we put the specialisms at the front door, which is really expensive and it doesn't work. So let's stop doing that. Let's work with people in a completely different way. Have generalists support people at the front door. And I think that's what you guys do really, really excellently, and what we as public service leaders need to learn from. So altogether, his total known contacts were 3,382 contacts, equating to almost £2 million. And we say we've got no money. This is where it's going. So we can't just keep getting money to fund the same old thing. And I think because you've got some fantastic practice, I've been reading about what you do, you could come together as a collaborative and put forward a business case for working differently with the third sector in Dumfries and Galloway to all public services, because you have the evidence that it works, and I think you could do it and save money and have better outcomes for people. So one of the things I've been working on is this thing called radical place leadership, which is basically you start all your service design with people. You know, why would you not put people at the start of your service design? What we tend to do is we put services at the start rather than people. Start to get to understand the reality of people's lives. Come up with a shared vision across all the partners in an area. Empower frontline teams, including the third sector people working in a neighbourhood, to do relational practice at scale, to get to know people, to work to support them. Look at where the money's going, as I've just described, and then end with the person. How far has this person moved on? We were just chatting before, not how many sessions has a person attended, but how different is their life? You know, these are the kind of outcomes that we should be measuring. Where does all the money go? It goes into those silo services, and the servicing of those silo services starts quite often in government, although I do think, again, Scottish Government has a much better policy framework, but even so, it starts from the government perspective. And basically it just passes people around the silos, repeated assessment and referral, which is really soul-destroying. We had social workers in tears in Wigan when they found this out. All their best efforts were to no avail. It didn't actually help people. Start to really invest in general practice, in GP practices, community services, and the community and voluntary sector. That's where there's an underinvestment, and that's where you can have the biggest bang for your buck, is investing more in the community and voluntary sector. So I've been working with South Ayrshire, who are doing some incredible stuff with communities, and this is an example of a mum and her child trying to navigate the complexity of the SEND system, children with social and emotional needs. And we map this out. Just look at that. Would you want to design a public service system like that if you were starting with a blank sheet of paper? And it's because we've started with the silo of the organisation and the service rather than with the mother and a child. And that's how we need to reset and rethink the whole way that we run public services. I think the best way to do it is through neighbourhood teams. Integrated local neighbourhood teams are between 30 to 50,000, where you focus on individuals and families and you focus on the relationship. And everybody working in that place, whether you're in the third sector or in the public service sector, starts with identifying who are the top 100 families we're all working with, but working with individually. Let's start out with working together to come up with a plan for each family. Give them a key worker and start to work to build up that trust and confidence in those local neighbourhoods. So I wanted to end, because I hate it when people go over their time slot. This is my last slide. So there is enough money in the system, I would argue, to deliver really good support to families, to individuals, to communities, but it's in the wrong places. It's in the acute crisis response where we leave things too late. It's in assessment and referral repeatedly, and it's not in the third sector. So the third sector, I think, has the expertise, it has the flexibility, it has the willingness and the bravery and the courage to work differently. So come together to deliver, a genuinely relational provocation and challenge to Dumfries and Galloway public service leaders. And just to show you that it does work, we shifted the relationship from parent-child with the third sector in Wigan. So we said to them, we had 15 million set aside as a transformation investment fund, and we gave it all to a community investment fund. And we said to these incredible people, come back to us and challenge us and tell us when we get things wrong and come up with a new model and way of working. And they did. 500 incredible projects that came from this community investment fund. And it was that work and investment in the social infrastructure, in the community infrastructure, that made the difference. It was that added the 7 years of additional healthy life expectancy. You have the answers. We did community asset transfers, we transferred swimming pools, libraries, all sorts of things with the budget to community groups, and it worked. Incredible. They managed to make profit where we'd made a loss consistently because we were clunky, metropolitan, rubbish way of doing things. We weren't in touch with the local community in the way that you are. So finally, I would just say to you, you have the answers. Go for it. You don't want to be just relying on handouts and this kind of micromanaging of your delivery. Really go for it, big style, with a big vision. I'm sure Alan will help you pull it all together. And I take my hat off to you. You're all incredible. And thank you very much for listening.